All right, we're going to go ahead and get started here. So welcome everyone. If you can put in the chat your name, your school, and what part of the country you're coming from, and we're going to go ahead and get started tonight. So welcome to our monthly webinar. The pathway and the webinar for this month is the pathway to osteopathic certification. If this is your first time with NSS, we are the National Student Society of ACOOG, and this is the board for just a couple more months. So I'm the president. My name is Pooja. I am a third year at Touro University, California, and I will let the rest of the board introduce themselves.
Hi, my name's Brianna, but everybody calls me Bree. I am a third year at Ohio University's Dublin campus, and I'm still in Central Ohio for my rotations.
Hi everyone, my name is Andrea. I'm a fourth year at Kansas City University Joplin campus, but I did my third year in New Jersey, and I'm the secretary for NSS ACOOG.
All right.
Hi. Hi, my name is Rayleigh Abel. I'm a fourth year. I go to DCOM, Harrogate campus. I'm currently on an audition rotation in Bowling Green, Kentucky, and I'm the social media chair for NSS.
All right. So the goals for the webinar tonight are to learn about the American Osteopathic Board of Obstetrics and Gynecology, AOBOG, and its role in OBGYN board certification, learn what to expect throughout the certification process during and after residency, and identify resources and opportunities for pursuing osteopathic board certification in OBGYN. We have a wonderful speaker tonight, Dr. Kurt Ludwig. Dr. Kurt Ludwig earned his Doctor of Osteopathic Medicine from Midwestern University Chicago College of Osteopathic Medicine in 1998 and completed his OBGYN residency at Mount Clemens General Hospital in 2003, where he served as chief resident. Dr. Ludwig has served as the OBGYN residency program director at Henry Ford Macomb Hospitals since 2007 and is a senior staff physician with Henry Ford Medical Group. He also holds an appointment as assistant clinical professor at Michigan State University College of Osteopathic Medicine. In addition to his clinical and educational roles, Dr. Ludwig previously served as chairman of the OBGYN service line at Henry Ford Macomb Hospital and has been actively involved in numerous national committees, including the ACOOG Postgraduate Education and Standards Committee, the AOBOG Osteopathic Continuous Certification Exam Committee, the ACGME OBGYN Milestones Work Group, and the ACGME Review Committee for OBGYN. He currently serves as a trustee on the ACOOG Board of Trustees, further demonstrating his dedication to advancing osteopathic obstetrics and gynecology on a national level. Dr. Ludwig is a dedicated educator and frequent lecturer on osteopathic graduate medical education at national conferences. He resides in Grosse Pointe Shores, Michigan, with Dr. Linda Koretche and their children. He enjoys traveling, golf, and spending time with family and friends. So welcome, Dr. Ludwig. We're very excited to have you. I will go ahead and um, turn over this part to you. So I'll stop sharing my screen so you can share yours.
Thank you very much. Welcome, everybody. Thanks you for the delightful introduction, Pooja. Let me go ahead and start sharing. Share. And I think it's that one. All right. Can everyone see that?
Looks great.
Okay, excellent. So we also welcome Dr. Michael Drea, and he is the executive director at ACOOG, as well as Catherine Ware at ACOOG, and Mary Cameron, yay, the executive director of the AOBOG, to join us and chip in and answer any additional questions that you guys have. So I am currently the chair of what used to be the Program Director Outreach Task Force. We made it through a full committee through the Board of Trustees, and now is the Graduate Education Outreach Committee. And we developed a presentation to educate our DO medical students. Okay, so if you happen to go to a legacy allopathic residency, You're not always informed on how to stay active in your college, which is ACOOG, as well as how to get board certified in the AOBOG. So this is just kind of to introduce you and to guide you along in the process. All right, so our learning objectives are what Pooja had already mentioned. We're going to introduce everybody to the ACOOG, who we are, who the AOBOG is, what are the certification timelines and requirements for the AOBOG and the ABOG, and why you should choose the AOBG certification because you are a traditional osteopath. All right, so that's our current logo, was renewed last year. I think it's lovely. It has the infinity sign, meaning we're going to go on forever. This is our current board executive committee. Dr. Papp is the current president. She is a OBGYN generalist. Dr. Jennifer Nichols is a infertility specialist in Florida, and she's the president-elect. Dr. David Jaspin is the vice president, and he's a generalist in, I believe, New Jersey. Dr. Jason Mead is a urogynecologist, and Dr. Ashley Hood is our outgoing immediate past president, and he is a generalist in Kentucky. This is our board of trustees, everyone dedicated to the osteopathic profession. Everyone smiley, friendly. We're not big and scary. Come and talk to us, okay? Don't be afraid. We're very approachable. All right, so as we mentioned, Dr. Druria is the executive vice president. Andrew Krim is our director of education. Jimmy Evans, our director of finance. Martha Prudhomme is our managing director of program service. And Catherine is our membership manager. So what is our mission? The mission of ACOOG is committed to women's health through the osteopathic and holistic practice of OB/GYN. Our vision is to provide an aspect community with the support that you need for practice, the fellowship that you need for practice, engagement with your colleagues, and respect of women's healthcare professionals. Our values, we offer member support, member that is all driven by our members, not by any political action committees. We are compassionate and accountable and approachable, as we mentioned. We're not big and scary. We promote fellowship through lifelong communities, access to our member network, which we'll talk about later, what the expanse that we have, and inclusive of all. We have several opportunities for engagement when you do graduate from your residency, including leadership roles, teaching and mentorship, and scholarly activity. So what are membership evidence? So we give CME discounts on annual conferences to our ACOOG conferences, which can average about $2,000 a year. We do advocacy on the national, local, state, and federal levels through the AOA. We have job postings and career opportunities that are available. We have volunteer opportunities to get involved with your personal professional interests. Fellowship. The fellow of the American College of OB/GYN is a mark of professional excellence, signify high standard expertise. So when you become a fellow, you're invited into our community. We always have a ton of networking. We all know each other. Please get involved. We're going to talk about bird certification. And we're personal. So when you call us up, you're not going to get an AI bot talking to you about what to do as me get through ACOG. You're going to talk to Catherine or Martha directly. And if you can't get hold of them directly, they're going to get right back with you. And we also have publications directly emailed to you through our membership organizations. So this is the logo of the American Osteopathic Board of OB/GYN. What is AOBOG? It's a certifying body. It does not create educational materials or curriculum, okay? That is set by the ACGME, which used to be set by the AOA. The AOBOG sets the standards for professionalism as well as eligibility requirements for our expands based on evidence and grounded in psychometric rigor. Everything that we do is psychometrically analyzed. We develop blueprints to establish criteria for our candidates and through Mary, as well as she advises the ACGME Review Committee, which I sit on when setting our standards, so they know exactly what's going on with the AOBOG. To the members of AOBOG, Dr. Paul Whittam is our chair, Dr. Jim Lindemulder is our vice chair, Dr. Deborah Herkeroth is the executive committee member, Dr. Linda Karachi is the chair of the written committee, Dr. Robert Seiler is the chair of the Osteopathic Continuous Certification Committee, Dr. Carolyn Skodarlik is the chair of the board committee, and Dr. Patrick Woodman is the head of Eurogyne, and Dr. Velez, correct me if I'm wrong, Mary, she's the head of MFM, correct?
No, she's involved in OCC and the written exam committee.
Okay, excellent. My mistake. Thank you.
No, it's okay.
That's why we have you here. Okay, so what are our eligibility requirements and how do you get through board certification with the AOBOG? So first you have to graduate from a medical school. You either a DO accredited medical school, a US or Canadian medical school where you get an MD, or a medical school outside the US. You then take a ACGME accredited residency, which is all we accept. You have to take an ACGME accredited residency, and then you have to maintain licensure and professionalism in your state. So you need to adhere to the AUA Code of Ethics. You need an unrestricted license to practice in the US, its territories, or Canada. So what's the timeline for getting your certification? So you usually will take your written exam in the third or fourth year. Okay, that's usually in April or May of that year. You then graduate from residency. When you graduate from residency, your program notifies the AOA of your residency completion. If they have not, we can give you a sample letter that they can send in to the AOBOG and sign off that you have completed your residency from an ACGME accredited residency. Graduation, December 31st of the 6th year following, you are board eligible. The oral exams are given in the spring and fall every year, with applications opening 6 months prior to the exam. So our oral exams are usually given in roundabouts October, early November of each year, and late April to early May of each year, which differs from the allopathic board exam, which is only once a year in the third or fourth year. Our written exam is given once per year in May, late April. PGY 3 or PGY 4s. It is remotely proctored. We are having a hybrid option coming in 2027. Well, you will be able to go to a testing center and take the exam as well, rather than having it remotely proctored in your home or place of choosing. Again, our oral exams are given twice a year in Chicago, and those are the exam fees. And we'll talk about those and how they compare to the ABOG in just a bit. So the applications open 6 months prior to the exam and then close 3 months prior to the exam. So you have a 3-month window to get registered for the exam. What the AOBOG does not require is minimum time in practice. It does not require the fundamentals of laparoscopic surgery or EMIGs. ABOG does require that. What is fundamentals laparoscopic surgery or EMIGs? It's a laparoscopic training program. FLS was developed by the American College of Surgeons, and EMIGs is developed by the American Association of Gynecology Laparoscopists for certification, not certification, for to take an exam, including a didactic exam and a proctored exam to show your laparoscopic skills. AOBOG does not require you to collect case logs. We do accept the ABOG qualifying exam, a pass rate on that to take the oral board exams. So the written exam is computer-based. It's remotely proctored. It is given over a 3-day window in the spring. The exam is 4 hours long with 225 multiple choice questions. The current blueprint is approximately 40% gynecology, approximately 36% obstetrics and maternal fetal medicine, approximately 9 to 10% REI, 7% urogynecology, and approximately 5 to 6% GYN oncology. We do list our references on the website for you to review and study from, and results are usually distributed within 8 weeks or less. Our oral exam is given in person in Chicago, as we said, twice a year in the spring and in the fall, over 2-day windows. The exam is approximately 4 hours long with 3 stations lasting no longer than an hour and 15 minutes apiece. Our topics include general OBGYN, including office, hospital, and outpatient topics, GYN oncology, maternal fetal medicine, reproductive endocrinology and infertility, urogynecology, and we also test professionalism, communication skills, and lifelong learning and osteopathic knowledge because we are an osteopathic certifying board. That's a really cool picture of Chicago, Mary. All right. Ask you, what is you want? How do you keep connected? How do you let Mary know that you want to be active and involved and take the written and oral osteopathic board exams? So ask your program to send your training verification to the AOA at this email address. You might want to take a picture of this. And it needs to include your program's name, ACGME ID, your name, your AOA number, your dates of training, your anticipated end date, a verification of your PGY 3 or 4 status for written, and a completion for oral status. Okay, and that's an example that we have, and we can easily distribute to you for your program director to complete or program manager and have them sign. You should check the AOBOG website regularly for dates, deadlines, and other exam-specific information. And make sure you keep your contact information, your email address, phone numbers, etc., okay, updated with the AOA and the AOBOG. And did you know that membership in ACOOG is free throughout medical school and your residency? Again, the AOBOG exams are accepted for ACGME requirements. They have to. Pass rates are reported to the ACGME and program annually. There are no specific guidelines regarding your leave during training, okay? Where the ABOG gives I believe, a 3-month time span for maternity leave. There's no specific guidelines that the AOBOG says that you have to achieve. There are also reentry pathways for candidates beyond the traditional board eligibility. All right, and this is just to say that according to ACOG, they encourage all OB/GYN residency programs to accept results of the COMLEX and not require or pressure applicants with DO degrees to take additional licensing exams, disproportionately burdening them compared with allopathic trained applicants. So this is per ACOG and it is virtually universal now. So you're an MD or DO student and you go to an ACGME residency, and then you take the AOBOG or the ABOG written exam in orals, and you become a member, hopefully, of ACOOG and ACOG if you so desire. So what is a cost breakdown? So it's pretty comparable. So over the entire certification process, the written exam fee for the allopathic boards, the AOBOG, is slightly higher by $600. The oral application fee for ABOG is higher, but the exam fee is lower. But in the end, they're comparable within $300 of each other. Our annual certification expense for AOBOG is about $300 and $290 for the ABOG. So it's pretty comparable with both boards. What is osteopathic continuous certification? So osteopathic continuous certification is required by the AOA and it involves 4 components. You must maintain an unrestricted licensure in the United States, territory, or Canada, or in the state that you're in. And you must adhere to the AOA Code of Ethics, meaning that you haven't been drawn up by any licensing boards and investigated or anything like that. It also involves lifelong learning, continuing medical education, which is part of your CMA cycle of 60 credits per 3-year cycle that are in 25 specific to your specialty. There's a cognitive assessment that is developed by the committee that I am on, the OCC committee, which is a series of questions that is administered online that you take quarterly in order to keep and show your knowledge. There's also a practice performance assessment and improvement, which involves showing activity in quality improvement projects over the 3-year CME cycle. What is a quality improvement project? So when you graduate from residency and become an attending, for serving on a quality board or being involved in your department's morbidity and mortality projects is the same thing as a quality improvement and suffices. So to sum up, over the long run, the costs are comparable with AOBOG versus the ABOG. We do not require case logs. And because you can get certified as soon as approximately 6 months to a year after, it can lead to increases in pay. We know that most practices and definitely institutions are offering an increase in pay once certification is done, which can be considerable. I know in the Henry Ford system, it's a difference of approximately $50,000 a year, which is very lucrative. Things consider when choosing your path. The AOBOG's written exam is remotely proctored, and we have a testing center. For the ABOG, you have to go to Texas to take the exam. AOBOG accepts either the allopathic or the osteopathic written exam as a precursor to our oral exam. Our oral exam is administered twice a year in Chicago versus once a year in Texas. There are also options for taking the osteopathic board exam virtually, especially if you are on military duty, interstationed out of the country, or perhaps you even live and practice there. Our OCC process uses longitudinal assessments that are given quarterly. We do have single step subspecialty certification for those who do go on to a fellowship in GYN oncology, maternal fetal medicine, reproductive endocrinology and infertility, and urogynecology. And we are actively developing subspecialty certification in advanced benign gynecologic surgery, which was known as MIGS, okay, with our first exam projected for 2027. That will be a first. There is no certification process for that through the AOBOG. We are also working on certification in pediatric and adolescent gynecology, with our first exam being as early as 2028. So our mission is to foster true community with everybody involved and have a small community. We're approachable and fun to be with, we think. We encourage members to interact and support one another informally and through opportunities for leadership to be involved with your college. So we have some attestations from DOs who are working in traditional allopathic institutions. Dr. Olfers is a examiner for the AOBOG, and he is stationed at Walter Reed National Military Center, Uniformed Services. He did his residency at St. John's Episcopal and his medical school at A.T. Still in Kirksville. And he's been able to shape his direction of the profession and create meaningful connections with experts medicine from an early stage of career, being osteopathic board certified. Dr. Herfel is in practice at Duke Health at Raleigh, Durham, North Carolina. She is an assistant professor for OBGYN, and director of the OBGYN Residency Global Health Program at Duke University. She did her fellowship in women's global health at Duke University and her residency at Ohio Doctors Hospital in Columbus. She graduated from Ohio University College of Osteopathic Medicine. Dr. Paul Sparzak is in practice as well as at Duke Women's Health. He's assistant professor at OB-GYN at Duke University. He did a minimally invasive fellowship at Duke University as well, and his residency at Beaumont Hospital, the traditional Botsford Hospital in Farmington Hills, in his medical school at Midwestern University of Chicago. He is a fellow review committee member with me on the OBGYN RC. Dr. Visconti is actually a graduate from my program at Henry Ford Macomb. She's in practice with Dr. Sparzak at Duke Health in Raleigh, where she is also an assistant professor, and she graduated from A.T. Still University. All right, these are contact informations for Andrew Krim, who's the Director of Education for ACOOG, and Mary Cameron, who is the Senior Certification Director for the AOBOG. All right, so that ends my presentation. I'm going to stop sharing, and we're going to open up the room or the Zoom to any questions that you have.
Go ahead.
What's that?
Sorry, I was just going to say, go ahead. Yep.
Oh, I just wanted to add a few things if Dr. Ludwig doesn't mind.
Absolutely. Thank you, Dr. Drea.
So number one, an ACGME requirement once you get into any residency program is for your program director to explain that you have the option of taking the ABMS boards. In the case of OBGYN, it's ABOG, or AOA board certification. And in the case of OBGYN, it's AOBOG. That is a requirement. It's in the ACGME standards. Most program directors will overlook that and kind of encourage you to take the ABOG exam. And they will give you various excuses as to why you need to take the ABOG exam, that it will affect their board certification rates, which is not true. They might say, I don't know anything about that board exam. Well, they don't need to know anything about that board exam. Only you need to know about that board exam because it is equal in the eyes of Medicare. And being equal in the eyes of Medicare means it's equal in the eyes of every insurance carrier in the country. So you will be able to participate. You will be able to say to any insurance carrier and any hospital that you are board certified. Hospitals do not discriminate. The AOA has a legal department that will fight for you if a hospital tries to discriminate against you based on osteopathic certification. So I know that was a lot of information, but just remember it is equal, and it is an exam for general OBGYN physicians given by general OBGYN physicians. So if you take the ABOG exam, you might get someone asking you MFM questions who wrote textbooks about preeclampsia. So, and they might get into the weeds. So just keep that in mind. Did I miss anything, Dr. Ludwig?
No, thank you, Dr. Drea. That's a very pertinent point that, yeah, as you enter your residency, you can take the osteopathic or allopathic board exam. All the ACGME requires is that the residency has to have an 80% pass rate on either of the exams over a course of 3 years.
And it's a total 80%. It's not 80% of each.
Correct.
If anyone has questions, feel free to come off mute and ask them. I do have a question. can start us off with. Um, when does a resident need to decide kind of which certification process they want to go through?
You want me to take this one, Dr. Ludwig?
Well, I would say right now we want everybody to vow that they're going to take the osteopathic board exam when they become OBGYN residents. But otherwise, I'll hand it over to Mary.
Yes, I fully support that. Really, when I talk to residents, and we do it a fair amount, or program managers and directors and things like that, the decision needs to be made when you're getting ready to take the first step, the written exam, or what ABOG calls the qualifying exam. ABOG has a dashboard and they have different, things you need to check off along the way that start as early as your first year of residency. And AOBOG, we really try to simplify the process, both for you and for us. So we don't have quite as many hoops to jump through and things like that. I usually say if you want to keep your options open, do what they're asking of you along the way, so that you're not playing catch up when all of a sudden, if you do decide that you wanted to take the ABOG qualifying exam. But really, the decision point is when you're getting ready to apply for that first exam. Until then, your first and second years of residency, you can still keep your options open.
Go ahead, Arisha.
Hi, can you guys hear me? Sorry, I'm driving.
Yep, we can. Just be
Okay,
safe.
perfect. Yeah, I'm being safe. First of all, I'm Arisha. Dr. Ludwig, I'm actually rotating at Henry Ford Wyandotte currently. So it's good to see you.
Oh, great. Nice to see you.
So I just wanted to ask, what I noticed when I'm talking to OBGYNs, DO OBGYNs is, sometimes they don't really practically use their OMM, OMT. Would it be if I take these osteopathic boards instead of the ABOG, I think what it was, would this help solidify my OMM skills that I could feel more confident as an attending to use those skills?
So I'll just keep jumping in on stuff. You tell me to shut up if you need me to.
So, I mean, that's a great question. So as Mary's going to talk about that, the AOBOG is a certifying board. We don't do instructions. So that comes from your residency.
Right. From the residency, ACOOG has some great series as well. As far as like evaluating that skill set, there certainly is a component to that within the oral exam, although I would say it's a little more osteopathic principles. In practices, there is, like, we're not going to ask you to demonstrate perhaps how you're going to relieve low back pain in pregnancy. However, within osteopathic certification as well, especially if you're, come out of residency and you're really committed to using OMM in your practice, all diplomates of all AOA certifying boards have an opportunity to take an additional designation in OMT. And so it's a short multiple choice exam with a practical component where you would actually demonstrate your hands-on skills. So you can become OBGYN with the designation of OMT as well. And you could do that with, God forbid you don't become an OB-GYN. Of course, that's who we love the most. But you could do that, if you became an anesthesiologist or family practice or emergency medicine or any of the other specialties as well. Dr. Juria has another question. If he comes off mute.
I have a comment to add to what Mary
Sure.
talked about. The ACOOG has OMT sessions at our conferences. We are in the process of revamping a video series on OMM techniques, and Dr. Champagne put that in the chat. I just noticed that. So sorry, I didn't see it. So there are opportunities for you to maintain your OMT skills. And actually, one of my graduates from my OB program is actually faculty at UNT, and she will be at the fall conference, participating in the OMM sessions.
Excellent. And if you are accepted and do get into a OBGYN osteopathically recognized residency. So there's a separate certification for that. When you do finish your residency, you do get a certificate from the AOA saying that you did graduate from an ACGME recognized, osteopathic recognized OBGYN residency. Yes, Brianna.
So for those of us that are students, as we're starting to kind of think about residencies and programs that we would want to apply to, how do you recommend we engage with this information so that way, hopefully, we can find programs that we feel fully supported as DOs, especially as we consider certification with AOBOG?
So again, there's three osteopathically recognized OBGYN residencies in the United States. Beyond that, there's 12 legacy osteopathic programs, even in Michigan. And I believe there's 26 throughout the country. And I'm sure most of them are run by DOs. They just haven't gone through and got their osteopathic certification. Okay. So I would check into those residencies as well. And Mary or Catherine should be able to give you that list. But when you're looking, if you're looking for osteopathically involved in learning the OMT techniques, I mean, take a look at the faculty and see what the faculty ratio is, okay, and where their training is, and ask them when you interview, are you using your osteopathic manipulative techniques to treat patients? And if yes, is that taught in the residency? Does that answer your question, Brianna?
Yes, thank you.
You're welcome.
I have, I guess, sort of a related question, but for medical students that know they want to do the osteopathic board certification, what should we be kind of looking for in our residency programs that would help kind of support that?
I think
In
Dr. Drea has the answer. His hand
yeah.
was up for a second.
Oh, no, go ahead, Dr. Ludwig can answer it.
No, go ahead, Dr. Drea, and I'll comment on.
Oh, I'm just, talk to the residents in the program and ask them. I mean, I've spoken to a few residents who were DOs at various programs, and some, like I said, unfortunately, are strong-armed into taking the ABOG exam. One of my graduates who went into fellowship, it was strongly suggested by their fellowship program director to take the ABOG exam. And it's unfortunate that there's that type of thinking out there. But you, as the graduating resident, you have the option of taking whichever exam you want to proceed with. And an alternative is take if you're getting pressure to take the ABOG written exam, take the ABOG written exam, you graduate from the program, and then to take the AOBOG oral exam. And your program director couldn't do anything about that.
And of course, I mean, you're interviewing at the program. That would be a question to ask the program director and faculty. What support do you give for osteopathic certification from the AOBOG?
And if their answer is, gosh, I don't know, well, then you say, let me connect you to AOBOG and they'd be happy to provide you some resources. And you let me know who they are.
And
Because we would.
cell phone number.
Yeah, pretty much. Yeah. I think, and it's funny too, because I've talked to so many program directors from even, the traditionally allopathic programs and things like that. And then, so many of them have said things like, we just, we hadn't taken a DO because we just hadn't, I never had an issue necessarily, but the people before me didn't do it. They're like, and then I took one and holy cow, right? They're like, now I can't find enough of them. because really they're so impressed with the quality of the students coming out of the osteopathic schools, and the work ethic and so many different things on that front, which I think is great. And so, you know, when you make that good impression, or, hey, if somebody did it before you and that helps you get in where you want to be, that's awesome. But I think kind of the next phase of that too is, you really like us because we're DOs and we want to stay true to our osteopathic roots. And so help me do that by learning about the certification process. And really, occasionally it's an education game, right? Because they just don't know, or they don't know where to go for the resources. And so that's why we always say, okay, we're happy to come. The QR code on that is a link to a speaker request form. We get programs who ask us to come in and talk to them during didactics and just say, we don't know anything, so can you just bring it straight from the horse's mouth, and make sure that our residents know it's there. And we're constantly emailing. And I love program managers because they are your great avenues to get information straight to the residents. But yeah, if you ever see that there's kind of a lack of information out there, we are happy to educate. So feel free to connect us.
Yes, we want you to stay true to your osteopathic roots because we're cool.
I echo that comment.
Well, I do have another question, and I think we have time for a few more questions. So feel free to post them in the chat or come off mute. But my question is that I think sometimes you see folks who have both ABOG and AOBOG certification. Is there any benefit to doing both, or is it just, you're spending money that's not necessary to get both certifications?
I'll let Mary comment on that.
um, I think it was more common for people to get both before the single accreditation system for graduate medical education. And that was because prior to that unification of the accreditation system, to a point that Dr. Druria made earlier, where they said, oh, it's going to affect my pass rates. It used to. If they wanted to take an osteopathic exam, that counted against the program because they didn't have the data to say, well, your pass rate is X, right? It almost looked more like they didn't become certified. But because of the single, in which case, when you had a DO who really wanted to stay true to those osteopathic roots, they said, well, then I'm going to do both. And that's important to me. I feel like you see it less often now, since that merger started in 2015. I do also know that there were some people who opted to do both because they wanted to be faculty at an osteopathic medical school, and a lot of the osteopathic schools wanted osteopathic certification in their faculty and some of those kinds of things. So I feel like it's less common to get both. I don't know why somebody would perceive a benefit to doing both, but that is just the part of me that says, you have to do 2 continuing certification programs, and there's a couple of things that kind of cross over, right? The license counts for both. The practice assessment component you can use in either case, but it's double the money to maintain, and double the work. So I don't know if I'd do it, just honestly.
Yeah, I think that was traditionally, as Mary said, for faculty professors. So in faculty programs where they did do an allopathic residency. So they were DOs in allopathic residency before single accreditation. Then they got certified by the AOBOG, but now they're DOs and they took faculty positions at universities and they wanted them to become osteopathic board certified, which there is a pathway for. Any other questions?
I do have another one. This is related to fellowship. So, very far removed from us as med students right now. But when it comes to applying for fellowship, all fellowships have to recognize both ABOG and AOBOG, right? It doesn't limit any type of fellowship opportunities.
When you're applying for, oh, I'm sorry.
No, go ahead, Dr. Drew.
No, when you're applying for fellowship, you're probably not at a point where you've taken the written exam on either side. Fellowship programs are going to look at your CREOG exam scores, or which is your in-service exam scores that you take every year in your program, and they'll look at research projects that you've done. But you probably, the fellowship match is going to occur probably before you take any type of written examination.
Mm-hmm. Yeah, that fellowship match is usually in the fall of your senior year.
Right.
And most, so even though you can take our written exam as early as your third year of residency, I'd say about 10% of our candidates opt to do that. And a lot of them come from residency programs that specifically design the curricula to be like, you're going to be ready for this. Most still take it in the fourth year, and certainly on the ABOG side, they can only take it in their fourth year. So really, you're matching into fellowship before you even apply for the examination. So usually we don't, see or hear that there's a disadvantage on that front. Occasionally, I've heard someone say, okay, I matched into this fellowship and I told them I took my, that I'm going to take my osteopathic exam, and they didn't know, they said, can you get certified in the subspecialty with that? And, again, it's an education thing, right? From programs I just didn't know. The only comment I would make is if you find yourself interested in complex family planning and those fellowships, we do not currently have a certification in that subspecialty. ABOG does. Right now, it's not on the radar, which Dr. Ludwig talked about, we're working on ABGS, and we've got PEG coming down the pipe. By the time y'all would get out of fellowship, we certainly have those. But right now, complex family planning is not on the radar for development. On our side, we just haven't had enough interest expressed by our diplomate population and our candidate population at this time. So if CFP is your dream, then just very practically speaking, ABOG is probably your best bet because they do have a certification in it. But other than CFP, no, not really.
Yeah. And in applying for fellowship, if you took the AOBOG written in your third year, it's not even something you need to mention in your application. You're only going to get a pass-fail grade. It's not as if you're looking at a numeric score like your CREOG scores. They're more interested in your CREOG scores than that.
Yeah, and as far as I know, no fellowship does not accept AOBOG for certification. As Mary said, there's no certification through AOBOG for complex family planning. We have a legacy osteopathic residency, and all of our graduates have always taken the AOBOG, except for this year because one of our graduates is to match to a fellowship in CFP, so she is taking her ABOG. But I did encourage her to also apply to become AOBOG certified as a generalist.
One more thing I wanted to mention, and Dr. Ludwig and Mary can help me out here. When you talk about our organization, the ACOOG, as an organization and how we support our members, the whole situation of MIGs and PAGs came about because one of our members was denied access to an examination for pediatric and adolescent gynecology additional qualification. Correct? Help me out, Mary.
Yes, that's kind of where it started. With PEG in particular, it wasn't that she was denied, but she was able to get into a fellowship, and they said, well, what are you going to do? Because there's not an osteopathic certification. And, she said, when I was in residency, my program director always said you are not going to be hindered in your career because you choose osteopathic certification. And she said, and now I'm finding myself in a position where maybe I am. And so, we took that in front of the board and we said, okay, who else is out there? And we polled, and we found that there's a lot of people who practice, even if they're not fellowship trained necessarily, who practice enough PEG that they were interested in having a certification in it. And so we said, okay, the people want it, we're going to build it. kind of a field of dreams thing. Well, no, they asked for it, so we're building it. I guess it's the opposite of that. And a very similar thing with advanced benign gynecologic surgery. People were asking. We even had a couple of health systems call because they were reworking their credentials and said, ABOG has this focused practice designation in MIGS. Do you have anything equivalent that we can write into our credentialing as kind of low-hanging fruit, right? They're like, we're not going to exclude our osteopathic physicians. We'll just have to write things a little bit differently. And so we started going, okay, well, this is something we need to look at. And again, took a look and the numbers are good. People are interested. And so we said, well, then we need to build this for them. With ABGS, though, we took it a step further and, we're like, this is going to be a subspecialty. This is not going to be a focused practice designation. And went with it that way.
They asked and we answered.
Correct.
Correct me if I'm wrong, Mary. Is there a certification process for pediatric and anti-dialysis gynecology through ABOG? Or is that
So they also have a focused practice designation right now. But so it's kind of funny. We actually have a very good relationship with ABOG. I think some of that is just the very nature of OBGYNs. You guys are collaborative, right? They work together. And so we work together with them on a lot of things, which is fantastic. But so, when I say, oh, they're working on this or whatever, it's because they've told me they have. We talk about it. But they are actually looking to switch PEG specifically into a subspecialty as well. So I think they're planning on resubmitting that request by the end of the year is the last update I had from them. So by the time you all would be getting out of residency, it'll probably be a subspecialty with them as well.
All right, thank you. I think in these last few minutes now, I think it'd be great if either Dr. Ludwig, Mary, or Dr. Drea, if you could just kind of reiterate why it's important for us as med students to be thinking about this at this point. And then also, Dr. Ludwig, if you're able to share the slides, I think that could be very helpful for the students. So yeah, feel free, any or all of you, if you want to speak on that.
Go ahead.
What's that?
Go ahead. I'm just trying to figure out how to share the slides. Catherine, can you share that to the members that we have here?
Yeah.
So
I'm sure we can get that deck out to the NSS.
We'll get that out to everybody that was here.
So when you're talking about board certification, or when you think about your entire medical career, you've got all these milestones that you have to meet in medical school, and then you have to apply for a residency. So board certification might not be first on your list. But one thing to keep in mind is as an OBGYN, you're going to need hospital privileges. And most hospitals have a time limit on how long it takes to get board certified. So if you don't get board certified, usually within 6 years, you lose your hospital privileges. That's number one. So that's a fact of life, whether it's AOBOG certification or ABOG certification. So once you're into an OBGYN residency, you start thinking about, wow, board certification is only a few years away. And I'm going to start looking at when am I going to take that exam? Like, do I want to take it in my third year? Do I want to take it in my fourth year? A good indicator of how successful you will be on either exam are your CREOG scores. So the CREOG exam is your in-service exam. You're going to take it every year while you're a resident. So you're going to take this exam 4 times. And usually the score on your CREOG exam will be a predictor of your chances of passing the written exam. As Dr. Ludwig pointed out in the slide deck, for AOBOG, you could be board certified within 6 months of graduating from residency. And that's a big deal. And it's out of the way. And it's all finished. All that information is fresh in your mind when you come out of residency. And you go in and you take that oral exam and you're done. And then you just have to worry about the OCC process, which is relatively straightforward. It sounds very confusing when you keep everything straight. So it's just something to be aware of. And the proper information is usually key to be less stressed about the whole situation.
Mhm. Yeah, and I think, as much as anything else, I think a lot of it is just knowing. And if you take one thing away from this, even if you don't wind up going OBGYN, but we certainly hope you do. But for whatever specialty you land in, when it comes to like the osteopathic certifying boards, the staff wants to get you through this. The boards want to get you through this, right? We know this is a big deal and it's a huge part of your career. Like Dr. Juria said, the exams are made by practicing physicians for practicing physicians. They're not up in, academia, the Golden Globe of academia somewhere, just sitting high on their pedestal. But really, we're here to guide you through the process and we want to help you with anything we can along the way. We try to do that by making the process as simple as we can. But hey, if you got a question, give us a call, shoot us an email. Like, I would much rather people not, like, it's stressful enough to think about like these career making exams, right? And so if we can make the process a little bit easier, or we can just calm you down, I feel like a therapist some days, and that's okay. But that's really, I think, what we're here for. And I think that is a big part of that difference in osteopathic certification as well, right? I am not a physician, but if that is how I can do my osteopathic touch, that's how I'm going to. So
I think it's important to be part of ACOOG, right? Because it's the osteopathic college. It's your college. You went to a DO medical school for a reason and got training in OMT and osteopathic philosophy for a reason. And I think our college is very small. So when you have a large organization, it moves slow. When you have a large organization, they aren't necessarily up to pertinent content and evidence-based medicine and practice improvement things that ACOOG is always identifying and lecturing on when you come to our conferences, come to our CME education. So we're really making it pertinent to what you need for your practice from not only education standpoint to treat your patients, but also a business standpoint, okay, in order to maintain your certification and maintain your practice. So we're really hitting where exactly you need to be as a graduate from a DO medical school.
All right. Well, thank you, Dr. Ludwig, Mary, and Dr. Drea for all of the great information for tonight. In this last minute here, I do just want to share some information for the students. This is how you can remain connected to NSS. That's our email, our Instagram, Linktree. You can kind of connect to us through all these ways. We do have the conference coming up, the 2026 Advances in Women's Health. That's October 1st through the 4th. It's in Fort Worth, Texas. There is an NSS student track during this conference on Saturday, October 3rd. So please do come. Elections will be happening on that day. So if you're interested in being on the board for the next NSS e-board, that is your time to run and, potentially be elected. And then we do have another webinar coming up in September, and that's all about how to excel on your OB/GYN rotations. We're going to have a panel of some really great OB/GYN leaders to speak to us on that. And that will be taking place September 16th, 8 to 9 p.m. Eastern Standard Time. All right. But other than that, thank you all for joining us tonight. We hope you learned a lot, and we will see you either at the next webinar or hopefully at the conference.